in the early 1960s, a group of individuals within this community came together and said, we need a hospital. Through their vision and perseverance, Seven Oaks came to be in the fall, September of 1980. And when they opened, it was 174 beds. And I think that first year they saw up to 17,000 patients, which was busy. So, those four fathers and four mothers really had the commitment and the dedication that we needed to open the front doors and ensure that it was, state of the art, looking at innovation and really providing excellence in care. Taking that and then putting together the components of what our campus of care looks like, what incredible insight that they had.
I've been here 39 years, and one of the reasons is because it's an amazing community of people that we work with. Not only the staff, but also the patients. One of the values of Seven Oaks Hospital is patient-centered care. The vision of prevention here at the hospital is also sort of key at the wellness, at the Chronic Disease Innovation Center. We don't just care for that individual and send them home, but it's much more holistic in its approach.
Seven Oaks has always had a culture of innovation. We come together, we talk about what some of the issues and challenges are that we face from a patient perspective, from clinicians, come up with ideas and solutions, and we're not afraid to try new things.
Overall, we have 208 beds, and we're not only servicing Seven Oaks, but we're also serving the greater Winnipeg region. And currently, we are the third busiest urgent care today in Winnipeg. We also have Jerry Rehab, and then we provide medical care to those patients that require medical admission. Renal health is absolutely a huge program here at Seven Oaks. So we're an incredibly busy hospital.
So I've been here since 2003. And at that time, it was a small dialysis unit. There was probably 15 stations. And now we've morphed into the largest dialysis program in Manitoba and probably one of the largest in Canada. We treat over 360 patients on hemo, just in-center. We have the largest home hemo program at 140 patients, and in North America, that's probably one of the largest out there. We're one of two provinces where our population on dialysis continues to increase.
Worldwide, but especially in North America, we're suffering with a huge burden of chronic disease. When it comes to rates of obesity, hypertension, hyperlipidemia, and diabetes, the numbers are skyrocketing. So the prevalence of these chronic ongoing issues that all of us collectively are suffering with is having a huge impact on our healthcare system already, and the impact is going to be exponentially worse in the years to come. About 3 decades ago, under the great leadership of a community board with a very supportive medical leadership team, we conceived of and built the Wellness Institute.
The Wellness Institute is a medical fitness facility that delivers health promotion, disease prevention, chronic disease management through evidence-based exercise, dietary interventions, and other lifestyle interventions. Prevention is very much a part of the healthcare system. There was a huge opportunity at the time in the early 90s to innovate and develop some evidence-based resources and services to better support the community, patients being discharged, hospital staff, businesses, etc. So the board at that time made a decision in the early 90s to really investigate what would be the potential for our hospital to establish a facility that could be dedicated for that specific purpose, but also lead and innovate.
So over the last 3 decades, the Wellness Institute has definitely evolved. And that was always part of our commitment to the community. We've always studied the programming that we've done. We want to make sure that what we're offering is actually useful and current. We have profound data that document the great work that can be done with an ounce of prevention through facilities such as the Wellness Institute. The reduction in hospital admissions over the course of a 5-year time span for people that actively participated 3 or more times a week was in the neighborhood of 60%. The death benefit was in the neighborhood of 10%. Those are really significant numbers that could result in a huge savings for our healthcare system, but more importantly, a huge benefit to the individuals who are participating and trying to look after themselves better.
Our model has been duplicated internationally, and we're in the process of potentially duplicating it in other provinces. So it's very much part of our DNA, if you will, is always looking for solutions to some of the issues and challenges that we face as an organization, and patients most importantly, and our community, and being really open to trying new things.
We've gone from simply being a community hospital to a complex that includes Wellness Institute and Chronic Disease Innovation Center.
The Chronic Disease Innovation Center is a hub for innovation in kidney disease and cardiovascular or heart-related diseases.
We're really trying to solve the relevant problems affecting people with chronic diseases and affecting the healthcare system today to both improve care, improve health, and also improve efficiency of the healthcare system.
There is a huge number of projects across a lot of different spheres of care that we deliver. One of our core competencies is around using large data sets to answer important questions about healthcare, whether that be what's the prevalence of chronic kidney disease, how should we screen for it better, how should we bring care to patients in communities, specifically with First Nations partnerships better. We've made a lot of strides with that, and those programs for the kidney checks specifically are live in multiple Canadian provinces now. There's a whole host of other things I could speak about, but those are things we're very, very proud of right now.
I led work to create a risk equation for people with kidney disease to determine who's going to progress to dialysis or kidney failure. More than 150,000 physicians in more than 180 countries in the world use the risk equation in clinical practice every day. So that's a stamp to the quality and the impact of the work we're doing here.
Our group was the first group in the world to actually show that exercise during dialysis decreases abnormal heart function during dialysis treatments. That was really a seminal study that was done 5 years ago with a group from London. CDIC being situated within this campus is actually really a fantastic way of developing solutions and then trialing the solutions and also implementing them.
Dr. Saunders always puts it really well. We're this scrappy little North End hospital that's a community-based hospital, and we have a global impact with a lot of the research and things that we talk about and do.
We have a tremendous amount of support from the hospital site and the hospital foundation, which recognize kidney disease as an important disease in this community and in this province, and they've allowed us to innovate.
We received tremendous support over the years from the hospital foundation, where the university and others weren't interested in investing us, the foundation was. And as we sort of unfold the next chapter of growth, we have a very exciting future.
We're going to need the community support as we move forward and continue to build for the community that is building around us. We have the opportunity in the coming years to really sort of carve out what we want Seven Oaks to look like. Our community has been very supportive, and through investments in Seven Oaks, they've created a legacy from years and years ago, and that's also what we need to do, is continue on with that.
The foundation really looks at the needs, not only of the campus, but of the patients. Simple things that make a difference in a patient's life. And we often don't have the budget to meet those kind of needs. It's often these small things that have huge impacts in our patients' lives.
The foundation is the glue that holds everything together. Collectively, what we're trying to accomplish here at the Seven Oaks Health Campus, it's all about trying to get all of us collectively to live longer, healthier, and hopefully with that, happier lives.